welcome to this fourth part of the series on varicose vein, piles and varicocele. In this part, we are basically looking at the experience with the lifestyle correction on patients suffering from these conditions. In addition, what we had looked at earlier were the three phases of one, the causes, two, the current medical treatments, and third, the comorbidities or associated disorders that are normally found in such conditions. Here, the first question to Dr. Jody Thomson is, can lifestyle modulation and correction help to avoid procedures like surgeries for varicose vein or piles or varicocele?
Yes, definitely. Because I'm telling from my experiences. Patients who are having, they have tried many things actually. There are different type of patients come. One is actually they found out that there is problem and they have symptomatic with the varicose vein, and they have been advised for the surgery. They have not done any surgeries now. One group they are coming like that, and next is they have already undergone one or two procedures, but now again they are asked for surgery. 10 years back or 20 years back, they had a varicose selective varicose vein removal, and then after some time they had done a sclerotherapy, and now they are asked for a venocele or a radioablation or something like that. And another group is they have already done everything and they have a non-healing ulcer. They have done almost all the possible measures, but the ulcer is not healing for 1 or 2 years. It is continuing, and they will be wrapping their leg in a elastic bandage or something, and not even showing to their own relatives because that will be so. The condition may be so. What we can say about that? So that is the situation for many people who are suffering. In such conditions, most of them will be suffering from diabetes also. If you have a non-healing ulcer, the diabetes can produce non-healing ulcer. Along with that, this varicose vein is also there. It will be very difficult for them. And the treatment also. The conventional treatment view, everyone knows that this diabetes is there, insulin, all the medications. But your diabetes really will not be any, maybe some control, but it's with the medicine. No one will be, I have not seen even, not single person with multiple problems having a blood sugar control with the medication to reach the HbA1c 5.5 or even less than 6. Even with all these medication, the 7.5 or even 8 or 9 will be there. And I had seen with all these medication they will be taking, but the HbA1c will be 13 or 14. That is the situation, especially when there is ulcer or ulceration or something like that. It will, blood sugar also will be high. That will be the situation for many of the patients, and such patients also will be able to come out of the medication, and the most thing is come out of discomforts and to get the ulcer healed. And definitely, if all these things has to happen, the blood sugar and the BP and everything should be under control, and you should be out of the medication also, because all this actually corroding your blood vessels. This sugar, it is actually flowing inside the blood vessel. It is damaging you the endothelium, that is covering the lining this the canal. It is actually all these blood vessels, artery or vein. It is a canal, and the canal is corroding. Then how can you get relief? And when you get the pressure is increased. The intravenous pressure or arterial pressure, when it is increased, that is also putting strain on the vessels. And all these medicines you are eating, which is also getting into the blood vessel only. And they are also, it is not nutrition. It is also corroding. It is a toxin for the body. Anything other than a nutrition, even the nutrient which is excess. The glucose is a nutrient, but if it is in excess, or the triglyceride, it is a nutrient. But if it is in excess, it is actually damaging your body, your blood vessels. The most impact is happening on the blood vessels itself. Actually, the first damage happens on the blood vessel wall for the diabetic or hypertension or whatever that is actually manifesting in this retina, that is called retinopathy. In the kidney, it is called nephropathy. So that is the only difference actually, because they are the smallest blood vessels. So when it is impacted, and especially the delicate tissue, you are getting these problems.
Actually, when we talk about this varicose veins, piles, and varicocele and all, it is all to the patient. It is all that is something happening on the surface of the body. So generally, there is a feeling that if that is there on the surface, it is a problem. Why not remove it? That is the generally the condition that is understood. So when there is a possibility of surgery to remove it, uh, then what is it that actually the patient gains from keeping it there, and then looking at lifestyle correction and other such associated activities? What is it that will?
It's always better you try lifestyle correction first step. So any lifestyle disease, first mode of treatment is lifestyle correction. And if you do it properly, you don't need any other treatment actually. If you fail only, see, if you're getting varicose vein, initially doctors, if you're seeing a doctor in the initial phase of your varicose vein, they'll advise you only for weight reduction. And if you have a excess tummy or a protruding tummy, reduce your weight and do the exercise. And the exercise also is a very important role, because nowadays most of our tech is used sitting on the computer and not doing much of the work. So the blood is, see, actually this calf muscles is acting as the pump. They're the second heart actually. It's called, the calf muscles are called the second heart. They're pumping the blood up. And you are sitting idle, just doing some little things on the computer. And then this blood is pooling there. There's no mechanisms to come up. And if you're, along with that, if you're obesity, that is also very common with the sedentary lifestyle. Your tummy is protruding, and the intra-abdominal pressure is again increasing. The blood cannot flow into the heart. So first thing you had to do, if you are any doctor will advise that only. Only if you are asking for, doctor, I want to go for or ladies, they want to do for the modeling or something like that. But usually models and all, they will be keeping their body perfect, so they will not be having much problem. But those who are wanting for going for the beach or this bikini or the beach dress and all, then they want to, this looking ugly varicose veins want to get removed. Those things, definitely this cosmetic effect is there, but you are compromising your own health. Even for the future, if you need, everyone had heard about this bypass surgery and all. For the bypass surgery, the first thing what the doctors are doing is harvesting the vein from the leg. And then they disconnect it to the aorta and giving a bypass to the heart, the coronary artery. For that, this saphenous vein is used. And actually, that vein you are removing by the stripping or by doing sclerotherapy or all these procedures for the varicose vein, you are actually removing or destroying that. And the possibility of doing that also, actually, that is coronary artery bypass is needed. That is also a lifestyle disease. And even if you're if you're willing for doing the lifestyle correction, you don't need a bypass surgery at all. But there may be some reasons, or an accident, some blood vessel is damaged, then also this blood vessel can be of use. So if you are destroying that, the possibility of using that vessel for another purpose also, because with short distance, if you use also, the body can forgive you, and giving another part circulation, you can use that. But if you're removing this your blood vessel or destroying it, then how can you use that? So with my experience and my understanding about the science of our body, if you are having varicose vein, correct it at the earliest stage. Even if you want to a cosmetic effect, a small blood vessel is bulging, and you want to do a minor surgical procedures, but don't forget to correct your lifestyle. But if you're ideally, you should try to correct the lifestyle and correct repair the blood vessel, and you may get a very good cosmetic result also with the lifestyle correction alone. Because it may next day the surgery may next day give you result, but it will give you scar also. That you should remember. Even the micro-invasive surgeries, they will produce scars, small scars on the whole length of the your leg. And even the stereotherapy, everything will give you some scar also. So try the lifestyle correction first and do it sincerely. And get if you don't have much of the problem, you can do it by self understanding your body and get knowledge by yourself and gather knowledge and do it. And if you are not able to achieve it, you get a clinically supported lifestyle correction who is expertised in that.
Actually, when we are talking about these conditions, generally it is said that there is this chronic venous insufficiency that is underlying this condition, these different conditions. So, a person who is trying to improve his health by lifestyle modulation and all that, what should that person understand about this chronic venous insufficiency, and whether that has any big impact on these issues of varicose vein, piles, and varicocele?
See, chronic venous insufficiency means the blood flow in the veins is not blood is not flowing in the proper way. You simply understand that. And how the blood flow is facilitated in the body, in the veins. In the arteries, the heart is pumping. And heart is pumping most of the blood down, not up. Only for the head and brain in your need to go up. And for that, there is a big vessels are going up. And the other blood is going down. And this most of the blood is going down and it has to come up. And there's no pump. And how it is coming up? It is the muscles which is pumping the blood. The superficially, that it is under the skin, there will be blood vessels will be there. This veins will be there. That is the one we are seeing. Actually, the major blood vessels is lying inside the muscles. The calf muscles, it is actually pumping. It is actually the second heart actually, which is pumping. And then the thigh muscles. And even the abdominal muscles and even the chest muscles. Everywhere this muscle is pressing the blood into the heart actually. So, and also even the respiratory muscles have a major role. When the respiratory muscles is pushing the air out, then the heart is getting filled only that time. Actually, even the heart is filled, even the cardiac muscles, and even the this lungs is getting circulation, fresh blood when it is relaxed. That is, it is actually when it is shrunken, the heart. So it is very important that this pressure gradient, and we should understand that how our body works actually. With this real, actually we are learning in the school and all so many things we are learning, but we have very little time is only spent for our how our body mechanisms and how we can utilize our understanding about keeping the health, our body healthy. Even many of our understanding in the last few decades in the modern medicine is very much unscientific also. Many of the things, which is even this removal of this blood vessels and injecting and destroying these things, we should, the common knowledge, it is common logic you can apply. And even myself has asked our professors when I was doing my BBS graduation in the 1980s. I was asked this. I was wondering why this stripping of the vein is done for the varicose vein, and if it is done, what will happen for the blood vessel? How the blood will flow? We have asked. Then this professor said that it will. New blood vessels will come. That when we are removing the new blood vessels, we hope that new blood vessels will come and take up the work. So that is not that simple. It is it's already which is damaged, and the new cells coming. Also, that same problem they will be also facing. That is the reason again the recurrence is coming. And it is in the initial stage, in the early stage of varicose vein, there will be doctors also will be happy because the vein is not there. The problem is over. They are also thinking. But after 10 or 15 years, if the early stage varicose vein is removed, you get a very good result. The patient is happy, doctor is happy. But the things is coming only after a few years, we are seeing the side effects. And I'm saying actually, the side effects of what is most of the patients who are coming to me is had many of the surgeries and all. I'm seeing the side effects actually, so I know what was the problem. And what was the problem with the stripping and sclerotherapy and all? I'm seeing that. That's why I'm saying you should before going for these surgeries, you should think twice or thrice or many times and try to understand what is done during the surgery and what can happen in the future also.
Actually, as you mentioned, no, many things are not what they seem to be. For just like it is said that when you are walking, the pressure in your veins in the legs is lower than when you are standing, because it seems some action, muscular action is there working on those vessels. So what is how do we understand that? Because generally we will always think that when we are walking, there will be more strain on the legs and associated strain of pressure in the blood, in the vessels and all that. But it seems it is not like that. Why is it so?
See, if you're firmly standing, then your pump, the second heart, the cuff muscle is not working. So the blood is pooling only taking place. So the pressure will be increased. But if you are moving your foot up and down, actually you are moving this motion on your foot, that calf muscle will act and it will pump the blood up. So that alone is not sufficient. But when you are walking, you should understand that you will be moving the foot also, and you are moving the calf, or you are bending the ankle, and again you are bending the knee also. So that will make the thighs, the calf muscle pumping up, and then the thighs is pumping up. So your this pumping is happening. That is why the blood pressure is reducing. Walking, the blood pressure is the venous pressure is reduced because of this action. If you are standing still, there is no action. Only the pooling, the blood is not moving. If you are making a dam, that flow will be reduced. That's the same thing. That is only that pooling is happening. Actually, we should understand that actually there are 5 liters, around 5 liters of blood is in our body, and the venous system is the reservoir actually. And the heart is only a small, can contain a very small amount of blood at a time, and also the arteries also, it's not dilatable. But the particularity of this venous system, it is dilatable. It is made in that way, and it has so much of flexibility is there, and it is wall is very thin and elastic, and that is making is a reservoir. And if you stand for a long time not doing the work, or even you are sitting for a long time, you must have seen that even for a long time, if you are sitting in the idle, you can get the edema leg, and also or 24-hour or night flight and all. After that, many of the people are getting this deep vein thrombosis, blood vein thrombosis in the blood vessel, because of the stagnation of the blood. That is another important thing. If you are not doing the physical activity or not moving the legs, you may get the clotting also.
Actually, when we are talking about this blood vessel health, there is also an apparently look of some darkening of the skin and some sort of variation in the texture, some hardening of the skin and all, which is associated with this sort of problems, that is varicose vein and such. In such a situation, when this hardening of the skin or this discoloration of the skin takes place, what is the general outlook on that when we look at lifestyle correction point of view?
See, hardening of the blood vessels and the skin lesions, eczema. Initially, there may be eczematous lesion, then it is progressing to this non-healing ulcers. That is all because of the stagnant, this blood flow is not happening properly, and the toxin is accumulating there. This darkness is actually happening when this blood is stagnated. This RBCs is leaking out from the blood vessel, and this some chemicals, this pigment material like hemosiderin is forming, and that is actually making the skin darkened. It's very common. Many of these patients will be having darkening of the skin, scaling, and dry skin, and progressing to just like eczema and this ulceration. So these can be with I can I have seeing the other usual the traditional way of treatment, the surgeries and there's no medical treatment. Medication is available for this varicose vein. They're usually surgical treatment, and actually the patient who are coming to me is mainly after all this. They have tried out all these things, and even in our place in India, especially in Kerala, there is Ayurveda treatment also is there. They might just tried that type of treatment also, and even I have seen the patients who are applied this as a part of the treatment. This leech application also. Leech is purposely given biting this varicose vein part, and also that some needle prick also. There are so many different type of other not medical, the other type of treatment also has taken by the patients. So many, they have tried many aspects of treatment, including Ayurveda, homeo, and this modern medicine and other alternative medical treatment. And even for such patients, that if we are able to follow lifestyle correction in the prescribed manner, and in that actually what we are doing is making sure that the patient is getting enough nutrition and to minimize the toxins getting into the body. And as a part of that, we are actually trying to get rid of the medications taken for diabetes, hypertension, and other things. And that is all possible if the patient is doing the correct, just doing in the correct way. And if the most of these patients will be obese and they will be having excess fat in the body, the ideally the fat percentage for a male will be only 10 to 15%, and the female is to 15 to 20%. And but these patients will be having too much of fat, and it will be it has to be removed. It is acting as a toxin. It is increasing the inflammation, especially in the subcutaneous tissue. The inflammation is one of the reasons for this varicose ulcer and itching and problems. So we had to get rid of those problems also. Then only we will get the correct. Even the weight reduction is very important in this clinically supported lifestyle correction, especially for this varicose ulcer, varicose vein problems actually.
With this, we come to the end of the part 4 of this 4-part series on varicose vein, piles, and varicocele. In this last part, we were looking at how lifestyle correction is a very important part of treating these conditions, and if done correctly, it can help avoid the other surgical procedures and other treatments that usually always are associated with some types of complications. Thank you.